A cluster of measles cases in Montreal has officials on high alert, now at 14 infections.
We've seen that the level of coverage of vaccination is not enough for us.
Quebec launched vaccination clinics at multiple hospitals this week. Provincial officials estimate thousands of kids could be at risk since some schools have dangerously low immunization rates.
In Montreal, there are some schools that are very low, under 50, under 40, and even some under 30. So those are places that are really at risk to have a big outbreaks of measles.
More cases are popping up in Ontario as well. An adult in the province's cottage country got infected from an unknown source, while a child in Hamilton fell ill following a trip overseas.
When there are outbreaks, obviously it makes it that more critical for people to be staying on top of the vaccinations, particularly childhood vaccinations.
In 2017, close to 9 in 10 Canadian kids had both doses of the measles vaccine by their 7th birthday. But by 2021, that dropped to roughly 8 in 10 kids. A small change with big impacts.
Absolutely. We are headed towards major outbreaks.
This physician says unvaccinated children could bear the brunt.
That child is at very high risk for being hospitalized, being very sick, possibly even dying.
Over 100 cases.
So just how big can outbreaks get?
These figures show
This epidemiologist shared her team's new modeling exclusively with CBC News.
Once you get down to 60% coverage, that's here with the 0.6, you see a much larger outbreak that can potentially be in hundreds of cases.
In larger communities, low vaccination rates could mean thousands of infections.
If you end up with sustained transmission, Canada could even lose its elimination status for measles, which it's had since 1998.
So, Lauren, modeling is a mathematical prediction, far from a certainty, but how likely are these scenarios?
Well, we had several experts review these projections, and they agreed that big outbreaks are very possible in Canada for a few reasons. One being that there are these pockets of low vaccination rates in certain communities, and there are already massive outbreaks happening globally. We're talking nearly 60,000 cases over the last year across Europe. And of course, many Canadians will be traveling to those hotspots this month for March break. So I hope some of them are bringing back a nasty souvenir. Ian?
Lauren Pelly in Toronto.